Arizona reproductive medicine specialist is helping couples start families. Dr. Drew Moffitt is here to tell us how ARMS can help cancer patients still have a chance at families, which is very important, Dr. Moffitt, isn't it?
Yep.
So let's talk about what ARMS can do, because as someone gets diagnosed with cancer, they're going to be going into treatment, and the biggest thing is that the radiation can destroy eggs. And so you guys are helping them do something that's kind of interesting, and that's freeze the eggs to have a family later.
Right. So what happens, it's either radiation or more commonly chemotherapy. And the chemotherapy agents, not all of them, but many of them can basically kill eggs. And so the idea is to freeze those eggs before they have the chemotherapy, and for guys for sperm also. So they both have issues, and if they want to have children afterwards, it's a good idea to freeze before.
And this is great. You guys have awards in this, and it's amazing how you guys sit with them and talk the matter through and give all the different options with this. And it's kind of like, again, a way to start a family later on after you've gone through your treatment and everything. But how does it work when they come to see you?
So the biggest challenge is getting them to come to see me. I mean, this is a really critical time in their lives. They just get a diagnosis, and the doctor's talking about chemotherapy in 2 weeks, and so everything's kind of compressed into a very tense time. So the big issue is the oncologist bringing this up, because if they don't bring it up, then it really isn't on people's radar, and they never even get to us.
Yeah, and I think people, when they hear that, you know, they have cancer, no matter what type, they start to shut down a little bit and stop thinking about anything else. And they all may think going, well, I'll never have a family, I'll never be able to do this. And that's why you're here to speak about that, to say, no, we have an opportunity to help you do that.
Yeah, I think it's really helpful to have that conversation, because it gives people hope, because like you said, they kind of get blinders on, they just can't think more than the chemotherapy. But the good news is people are surviving and they're having their lives, and so having a conversation is about, okay, you're going to get through this and you're going to have this family, that gives people hope. And so we are a way of giving them hope too.
So after they go through all the chemotherapy and everything, and they're clean, you sit down again, and then that's when you help them start to put a family together.
Yeah, so then we talk about thawing those embryos, and a lot of times these people don't have partners, so we're freezing eggs or sperm. If they have a partner, we'll freeze embryos. The goal is to get things done before chemotherapy, and that can be a very quick thing that we have to do.
Yes, and so let me ask you, and I know this is probably, I don't know if it's your own or not, but someone's diagnosed with cancer and it's going through their body. Are the eggs still, I mean, able to be, you know, to be taken and have a family, even though they have the cancer in them?
Yeah, so most of the time, you know, the cancer's somewhere else. It's not in their ovary, right? It started somewhere else. And so the ovary is still able to produce eggs. Sometimes they're sick and we get fewer eggs, but if we're quick and aggressive, we can get some things stored for them.
And that's why it's great to have that talk, right? It's kind of like, I mean, on the list as you're going through things, as you prepare for getting treatment and stuff, is talk. And to have that talk with you, which is, and then, I mean, for people who are not going through cancer, but maybe another type of illness, it's great to sit down and talk with you to have that.
Yeah, I mean, we know time is of the essence, so we've told our staff, you know, someone calls with that, it's kind of a red alert for us. I get on the phone with them that day, and we start putting together a plan for them so that they know that, you know, they're not the ones having to, you know, coach this whole thing. We're going to help them through it. So.
Yeah. And we talked about your awards, and that's something that you really want to look at when you are going to have this talk and stuff, is coming to someone like ARMS to have this talk that has the awards, know what's going on with this.
Yeah, I mean, that's the critical thing, is you only get one shot at this, right? And so you need to get your eggs at a place that has really good outcomes. And if all you're doing is freezing eggs for cancer patients, well, they're not going to thaw their eggs for 10 years. So you need a place that is constantly freezing and thawing and has a big volume, which we do. And so we can say, yeah, you know, this is our pregnancy rate. We do great. And so your eggs are going to be fine.
Yeah, so very important. Dr. Moffitt, tell them how they can get a hold of your team to, of course, have this talk and to start a family.
The easiest thing is just go on our website, arizonafertility.com, and all the information's there.
Perfect. So, Dr. Moffitt, thanks for joining us this morning.
Great. Glad to be here.
All right. Stick around. We got more of the Arizona Daily Mix coming up after this.